Hello, welcome to Danos's computer-based training system. The following information will take you through your annual refresher training on the topics of blood-borne pathogens and access to medical records. First, we'll take a look at blood-borne pathogens, what they are, how you can be exposed, and what you can do to protect yourself. According to the OSHA standard, blood-borne pathogens are defined as diseases that are transmitted through bodily fluids such as blood or saliva. Since you work in an industry where there is reasonable potential that you may be exposed to blood or other bodily fluids in response to an accident, it is important that you understand how to protect yourself from possible exposure. The most common forms of blood-borne pathogens are the hepatitis B virus, the hepatitis C virus, and the human immunodeficiency virus, or HIV. Hepatitis C has been known to live outside of the body for up to 1 week and up to 2 weeks in a laboratory setting. When dealing with an injured person or cleaning up an area where an incident has happened, there is the potential that there may be blood or bodily fluids that you may come into contact with. It is important that you follow some basic universal precautions. Always assume that the area contains potentially infectious materials, so guard against potentially infectious materials. Use the appropriate level of PPE or barrier protection, such as latex or nitrile gloves. Some people may have an allergic reaction to latex. Glasses, goggles or face shields, masks, and protective, disposable outer garments. Use a mixture of 1 quart bleach to 10 parts water to disinfect any potentially infected equipment or work areas. Avoid accidental injury from sharp or protruding projects, and avoid biohazards. If you're exposed to potentially infectious materials, report the exposure immediately to your supervisor and wash any exposed areas with soap and water. It's important to know what your role in an emergency is in an emergency, or when rendering first aid to an injured coworker. Review the information in your site-specific emergency plan. The plan will help you to identify who are the trained first responders, a list of trained personnel, a list of notification responsibilities, where first aid stations are located, and any site-specific procedures that may need to be followed. The 4 basic steps that you need to follow in an emergency response are: notify your supervisor or the appropriate personnel as soon as possible. Assess the situation before proceeding to offer help. You must be able to ensure your own safety before you can help someone in an emergency. Don't become another victim. Stabilize the injured person in accordance with their level of training, or assist those who are trained to do so. Once the injured person has been stabilized, transport them to the nearest facility or medical provider. If you are confronted with a situation that requires your response or your help with administering first aid, remember, always protect yourself with the appropriate barrier of protection to any possible exposure to blood or bodily fluids. Remember to report the emergency immediately to your supervisor and report any possible exposure that you may have suffered, and respond only to your level of training. You as an employee have certain privacy rights guaranteed when it comes to the availability or access to your medical, testing, or exposure records. All test results must be kept in your medical and exposure files and are protected by privacy and access rights, and are not open to viewing without your written consent, except by yourself or recognized company officials. Also, your employer is required to maintain these medical, testing, and exposure records for 30 years past your last date of employment. Let's review. Blood-borne pathogens are diseases that are transmitted through bodily fluids, such as blood or saliva. The most common forms of blood-borne pathogens are the hepatitis B virus, the hepatitis C virus, and the human immunodeficiency virus, or HIV. Universal precautions should be followed. Use the appropriate level of PPE or barrier protection, such as latex or nitrile gloves, glasses, goggles or face shields, masks, and protective disposable outer garments. Use a mixture of 1 quart bleach to 10 quarts water to disinfect any potentially infected equipment or work areas. And always wash your hands and skin after removing your protective equipment, or if you have been exposed to any bodily fluids. If you are exposed to potentially infectious materials, report the exposure immediately to your supervisor and wash any exposed areas with soap and water. Know where first aid stations are located and know any site-specific procedures that may need to be followed.